Alright, I'm going to perform my hand hygiene. Alright, our patient for today is Miss Jessica Murphy. Her birth date is 2/21/1969. She's located on the 3rd floor, room 206, bed A. It is indicated that Miss Murphy is allergic to diphenhydramine, so we're going to keep that in mind when we're pulling her medications. So we're going to pull an oral, an eye, an ear, and 2 injections for her. So I am going to pull hydrochlorothiazide first. That's a tablet that's going to be 25 milligrams by mouth twice a day. So I'm going to pull these first. And these are 12.5 milligrams, and the expiration date's still good. I'm going to pull 2 of these for a total of 25. And then the next thing I'm going to pull is going to be afloxacin 0.3 otic drops for 4 drops in the right ear. So I'm going to pull those. I'm going to pull some afloxacin. And this is ofloxacin 0.3% otic drops, expiration date 10/20/20. So expiration date is still good. It's not cloudy, so I'm going to put that up here. And then the next thing I'm going to pull is going to be pilocarpine 4% ophthalmic drops. And I'm going to pull those. Pilocarpine 4%, expiration date 10/20/29. So those are good, still in date. The next thing I'm going to do is I'm going to pull Miss Murphy's haloperidol injection, 2.5 milligrams intramuscular injection. So I'm going to pull the valve for that first. Haloperidol lactate. 5 milligrams per ml, so she needs 2.5, so we're going to give her 0.5 milliliters. Expiration date is going to 12/28, so it's still in date. And then we have on here that Miss Murphy also needs some insulin, so we're going to pull an NPH insulin as well. And I'm also going to pull a regular insulin too. So I'm going to pull her regular insulin, and then I'm going to pull her NPH. All right. So the next thing I'm going to do is I'm going to draw up Miss Murphy's injections. So first thing I'm going to do is I'm going to get a 3 milliliter syringe, and I'm going to get a 22 gauge 1-inch needle because Miss Murphy is of average build. And the next thing I'm going to do is I'm just going to open these up. And I'm just going to attach my needle to the syringe. And I'm going to take this haloperidol and I'm going to clean the top of the haloperidol. I'm going to take my alcohol swab and I'm going to pull it in one, I'm going to clean it in one direction, and then I'm going to leave it on the top. Okay, so for the haloperidol, like I said, 2.5 milligrams, and it's 5 milligrams per milliliter, so I'm going to pull half a milliliter. So I'm just going to take this and open it up, and I'm going to pull half a milliliter of air first, just like this. I'm going to remove this alcohol swab. I'm going to push this right down into here, insert the air, and then I'm going to invert it and pull 0.5 milliliters of haloperidol. Alright, perfect. I'm just going to scoop up my cap and recap my needle and then ensure there's no air bubbles in the injection. The next thing I'm going to do is I'm going to take this tape and I'm going to label my injection with the name of the injection, haloperidol, and the dosage. I'm just going to wrap this around this right here. And then the next thing I'm going to do is I'm going to draw up Miss Murphy's insulin. So I'm going to grab an insulin syringe from right here. I'm going to take the clear and the cloudy, and so we need to check her blood glucose first. So she has a blood glucose of 266. So in order, on her regular insulin, it's on a sliding scale. So we need to take her blood glucose and do 266 minus 100, which gives us 166 divided by 30, which is 5.5, and we're going to round that to the nearest whole number, making it 6. So she gets a total of 6 units of regular insulin and then 14 units of NPH insulin, making it 20 altogether. So I'm going to remove the cap off the end of this, and then the next thing I'm going to do is I'm going to pull 2 alcohol pads and clean the top of my insulin vials. I'm going to clean in one direction and leave that on the top of there so it doesn't get contaminated by the air. And then I'm going to open up this one and clean the top of my NPH. Alright, so I'm going to leave those on top there so it doesn't get contaminated by the air. I'm going to pull the cap off of the needle, and I'm going to pull 20 units total of air. Alright, so first I'm going to insert into my NPH insulin 14 units of air. Just going to insert the needle down there, ensuring we're not in the liquid. And I'm going to insert 14 units of air, bringing us to 6 units of air left in the syringe. Alright, and then I'm going to remove that from the cloudy. And then the next thing I'm going to do is insert the air into my clear. So I'm going to push this down into here and insert the remaining of my clear. And then I'm going to invert this and pull 6 units of regular insulin. Alright, and I'm just going to remove this. And then I'm going to push this down into my cloudy, my NPH, and then pull the remaining. I need to make it 20 units total. Alright, perfect. I'm going to remove that, and then I'm going to just scoop up my needle cap here to ensure no needle sticks happen. And then, even though it's labeled with an orange cap, I'm still going to label the insulin syringe with 20 units of insulin. Alright, I'm going to put that on there. I'm going to put this on my med cart. And then I am going to put these back real quick. And I'm going to put this haloperidol back. Alright. The next thing I'm going to do is I'm going to grab my MAR. I'm going to make sure I have some cotton for her ear drops and some water, and then I'm going to bring this to the bedside table from the med cart. Alright, the next thing I'm going to do before I go in her room is I'm just going to check all of her medications again to her MAR. So we have hydrochlorothiazide, we have 25 milligram tablets, and we have 2 of those because they're 12.5 milligrams a piece. Expiration date is still good. The next thing that we have is pilocarpine 4% ophthalmic drops. The expiration date is 10/29. I'm going to compare that to the MAR as well. Pilocarpine 4% ophthalmic drops, 1 drop to the right eye. And then I'm going to also compare the ofloxacin 0.3% Odic drops, 4 drops to the right ear, and the expiration date is still good, 10/20/20. And I'm also going to compare her insulin injections. So insulin, 20 units total of regular and cloudy, and then haloperidol lactate, 0.5 milliliters because it's 2.5 milligrams intramuscular. Alright, and so we have all of our medications compared to the MAR. So the next thing we're going to do is we're just going to go into Miss Murphy's room. Hi, Miss Murphy, how are you today? My name's Casey. I'm going to be your nurse for today. We've got some medications for you. How are you feeling? Are you in any sort of pain? Alright, perfect. I'm going to pull this curtain too and give us some privacy. Alright, I'm going to put some gloves on. Alright, can you verify your name and date of birth for me? Alright, we have Jessica Murphy, and her birth date is 2/21/69. Do you have any allergies? Alright, diphenhydramine, and we have that listed on the MAR as well, and we don't have any diphenhydramine for you today. So, alright, so first thing I'm going to do is I'm going to lift you up a little bit. Is that okay? Alright. Alright, so what we're going to do first is I'm going to give you your tablets that you need to take first. Can you just go ahead and swallow for me? Have you had any trouble swallowing or anything like that? Alright, good, you haven't. So what I'm going to do, if you will just swallow these for me, and I have some water here for you. So here's these. There's your 2 tablets. And here's some water for you. Alright, you good? You okay? Alright, perfect. The next thing I'm going to do is I am going to do your eye drops first, okay? This is your pilocarpine. So, 4% ophthalmic drops. So I'm going to put this right into your right eye. And this is for pilocarpine, 1 drop to the right eye. So I'm going to grab a tissue for you, just in case. I'm going to take your eye and I'm going to hold it open just like this. And I'm just going to drop this right into the conjunctiva right here. And then I'm just going to put this here and hold the lacrimal duct. 1 drop in your right eye. Alright, perfect. You feeling okay? Alright. Next thing we're going to do is we're going to do your ofloxacin otic drops in your ear. And that is 4 drops to your right ear, okay? So I'm going to get you to turn your head for me. I'm going to remove this cotton, and we're going to give you a new piece of cotton, okay? Alright, I'm going to get you to turn your head just a little bit for me. I'm going to remove the cap off of this. And I'm just going to double check one more time. 4 drops to the right ear. Alright, I'm going to pull your ear up and back. And then I'm just going to drop this right in the ear. 1, 2, 3, 4. Alright. And then I am going to put the cap back on this and put this right in your ear, alright? I'm going to massage the tragus before I put this in your ear. Alright, feeling good? Alright, I'm going to get you to turn your head back towards me. Alright, perfect. Alright, the next thing I have for you are 2 injections. We have your insulin injection and your haloperidol injection. So first thing I'm going to do is just on her, I'm going to indicate where I would put her haloperidol injection. So first thing I'm going to do is grab some alcohol, and I would cleanse the section first. I'm going to show this on a demo pad first. So I cleanse the section, and then I am going to take my thumb and put it right near my palm, my left palm, and put it right on the greater trochanter, and then I would point my thumb towards the groin. I would take my index finger and put it straight up towards the anterior superior cervical spine, and I would take my middle finger and point it back in a V of sorts towards the anterior superior iliac crest. And then we're also going to do an insulin injection, and we would do that in her stomach as well. Now, she was stuck recently on her left side, so we're going to rotate and go to her right. And I would clean the section first and then inject in her stomach right here. And I'm going to demo that on this demo pad over here. Alright, so we're going to do a haloperidol first. I'm going to remove this. And I'm just going to clean in a circular motion. I'm going to allow that to dry. I'm going to take the haloperidol. I'm going to remove the cap. Hold the skin. Bubble up, and I'm just going to inject. I'm going to insert the medication, remove that, and then I'm going to scoop the needle back up to ensure there's no sticks. And then next thing I'm going to simulate is going to be her insulin injection, which would be in her stomach. So I'm going to take this, and I would have put a Band-Aid over that if there was any bleeding. I'm going to take this, I'm going to clean the injection site. I'm going to let that dry. I'm going to remove my cap off of the insulin injection. And then I am going to kind of pull the skin taut but pinch it together. That way there's a nice little tent for us to stick the injection into. And since Miss Murphy is of normal build, we are going to put it in at 45 degrees, bevel up, and we are just going to inject that. And then I'm going to put the cap back on the needle to ensure there's no sticks. And then put a Band-Aid over that if needed. All right, Miss Murphy, so I have all of your medications taken care of. Do you need anything else today? All right, I'm just going to take my gloves off and put some more hand sanitizer on. I'll be back in about 15 minutes to check on you. Here's your call light if you need anything. I'm gonna lower your bed back down, okay? Okay. Are you good sitting up like this? All right, do you need anything else before I leave? All right, good, thank you.